You're listening to Healing Voices Project, where we share stories and the latest information from people who fight addiction every day. I'm Mike Torville, your host and author of Voices from the Fallen. Thank you for listening, for following, and most of all, for sharing with people you care about. Make your voice count too. Hello everybody, I'm Mike Torville. Thanks for joining us at Healing Voices Project, here where we talk about all kinds of topics. We talk about addiction, we talk about recovery and mental health and all kinds of issues relating to that. Today we have a guest and we're going to talk a little bit about mental health and various aspects of mental health and how our community is affected by it and how our families are and so on. Amanda Hichborn, thanks for coming.
Thank you for having me.
Sure. And Amanda is a licensed mental health counselor with a very diverse background in the field. Currently, Amanda is the Director of Outpatient Services at Westfield Clinic of the River Valley Counseling Center. Is that correct?
Yes.
Did I say that right?
Yes.
All right. So you've been in the field for a while. You're now the director of this program. But you actually began your career at different jobs, right?
Right.
And so you began your career in a psychiatric inpatient unit at different local hospitals in Western Massachusetts before transitioning to the in-home therapy for children and families. And I know you've got some experience with children.
Yes.
We'll get into that a little bit. Now, for the past 5 years now, right, you've served as the director of the local outpatient clinic in community health mental sector. You've also collaborated with other experienced clinicians to establish recently a recovery center in East Longmeadow, Mass. It's called Balanced Recovery?
Correct.
Okay. You got a lot going on.
I do, yes.
And
I like to stay busy.
Yeah, I guess so. And you've had some experience, and I think when we talked earlier, you said that you started your career, at least, you started your career in third grade. But no, because you started thinking about it at such a young age. What possessed you in third grade to think about this as a career?
Yeah, in third grade, I remember doing a project and learning about the brain and how the brain and the eyes work together, and just the science of that was just so fascinating to me. And I feel like that kind of sparked a lifelong interest in psychology and a little bit of neuroscience. And it developed from there, and I took a psychology course in my senior year of high school as well. And then once I got to college and grad school, I couldn't get enough of psychology courses.
Was there any other field that you considered?
Actually, art.
You did? Art?
Art, yeah.
Art seems so abstract, and this seems so finite. It's a complete different brain work, isn't it?
There's also a field within psychology. It's art therapy, so I could have combined the two. But I think learning so much more about the science of behavior and like the clinical side of psychology and the diagnoses, like that grabbed my attention a little bit more away from the art side. But art therapy is very useful for clients, and it is a very it's a great modality.
So you can use your experience with art while you're practicing what you do now quite a bit.
Sure.
See, I didn't think the two tied together very well, but you just did it. You just tied it together, and that makes perfect sense.
Yeah, and some clinicians do actually. They take more of that art therapy path and get licensed in more of an art therapy approach or certified, or they take more training in that specific modality.
Well, let's talk about that. I didn't plan on talking about art and therapy, but how does art therapy make a difference?
So people are able to express themselves through different forms of art, whether it's painting, whether it's clay, whether it is like any sort of medium. They're able to express themselves and how they're feeling. If they're not able to express themselves as well, maybe verbally or emote in that social aspect
And
as well.
this is, and maybe we jumped ahead, and this is designed for what type of situation? In other words, who might benefit from this type of art therapy?
Really, anybody can use art therapy and benefit from it.
No.
It's a great kind of universal tool. It's I think it tends to work well with a holistic approach as well.
Mm-hmm. In terms of mental health.
Correct.
And okay. Now, when you started off, you went to college.
Yes.
Where'd you go to school?
Bay Path University.
Okay. Once you graduated, your first job out of college was where?
My first job was the mental health unit up in Greenfield at Bay State Franklin.
Mm-hmm. How did that go?
It was a great learning experience.
Yeah.
I saw and learned a great deal from people who were struggling at maybe their hardest moments in life. And I think each day was a valuable learning experience as far as the different walks of life that I was able to engage with, like demographically, different populations, different diagnoses. I learned so much, but there were some very difficult days as far as maybe safety.
You encountered situations that you didn't feel safe.
Yeah.
Physically?
Yes.
Yeah. That's tough. I mean, especially you were young, just
Right.
graduated, and you say, what the heck did I walk into here? It was a little overwhelming.
A little bit.
Yeah. But you learned, and you're talking about the demographics of this, and
Mm-hmm.
I'm not going to put words in your mouth. You can say it, but I'm thinking about what you might have learned is the type of people. Did you find it was confined to certain groups or certain people that were affected by mental health issues, or do you find it was just pretty much encompassed any type of group? In other words, where there's predominantly noticeable with one group or another, whether it was age, race, gender. How did you see that mix?
It was everybody. I saw very young adults and much older adults.
And I think that's the answer I thought, because it does affect everybody. I think when we talked earlier, you said one of the things you learned is just it can and it does affect virtually anybody in any group you could possibly imagine. No one's exempt from it.
Right.
And I think a lot of people with that too think, oh no, we're not going to have that in our family, and that doesn't affect us. But find that you hear more about it now. It wasn't talked about so much years ago. And I've noticed over the years, and I think you probably noticed, the stigma attached to mental health
Absolutely.
issues. In your career so far, and you're still young at your career, but you've learned a lot since then. How do you see the impact of stigma, and what's, if anything, is changing?
I believe that the stigma is decreasing around mental health. I think that, especially since COVID, more people are reaching out for mental health services and support.
Why do you think they're reaching out more? Because they feel freer to do that?
I think there's more acknowledgement around taking care of ourselves, taking care of our health, self-care, and just like realistically being more in the moment with life. Like, life is so short and valuable, and I think that there's become more recognition around we have to take care of ourselves here and now.
What do you think attributed to that? Was it COVID to some degree, or? I
think to some degree. I think the lifestyle during the pandemic potentially had an impact on that, as far as I think there was more focus on being with family when possible. I know that was a barrier for some people to be with family. Some people had that luxury, some people didn't. So I think that was a piece of it. And I think also when people were more isolated or more secluded during that time and struggled more, I think that put more of a light on the fact of I can't do this. I do need support. I do need this help.
Yeah, and I think it's certainly brought forth a recognition or an awareness that how important connection is with people.
Right.
And on the other side, how critical it is to avoid isolation. Because the isolation certainly could create depression and other issues like that. And you could see it in kids in school.
Absolutely.
Not being able to interact with their schoolmates, friends, and so on. You can see it at the workplace. Not being able to collaborate in so many ways. That isolation changed. And people did talk about it more through that, because it was, wow, hey, what do we see different here? My kids behaving differently. And it really had a detrimental effect, but it did bring out an awareness. Not maybe the way we wanted it, but it did, for what it's worth. If anything good came out of COVID, we recognized that how detrimental isolation can be and how helpful connection can be.
Absolutely.
You saw that a lot.
Yeah.
Yeah. At any age, too, I think.
Right.
And I think maybe you're right, that getting past the stigma, and a lot of people wouldn't talk about it. And you can pick any topic, whether it's years ago, alcoholism, drug use. If someone had a child who was addicted to drugs or had some issues, mental health issues, people wouldn't want to talk about it.
Right.
And it was the same way, but now, people are more open,
Mm-hmm.
and you're finding that's very helpful.
Absolutely.
Yeah.
I think the more we talk about it, the more relatable people are able to be, and the more that stigma decreases.
Absolutely, yeah. So it just kind of find its way through.
Yeah.
Now, after you left Greenfield, because you finally said, okay, I'm not feeling all that safe anymore, and it was a little bit problematic, you got another job.
Yes.
Where did you go
so
from there?
from there, I worked for a CBHI program, which is Children's Behavioral Health Initiative.
Where was that, in Western Mass? Or?
Yep, so I was in Western Mass. That was a program working with children and adolescents and their families.
Mm-hmm.
And I did that for about 2 years, and it was a lot. Very demanding, but that was also another really valuable experience, because in that role, I was meeting people where they're at, literally. So I was going into homes, going into schools,
Mm-hmm.
Supporting families at doctor's appointments or with other providers. It was really a more collaborative approach, and you really got to see the whole picture of how someone's life is impacting their mental health.
I'm going to ask a question. It's going to
Sure.
seem like stupid, but when you say that, when you meet them where they are, here's the ignorance of my question. How do you know where to go? In other words, you got to go visit a home with
Mm-hmm.
children. What brought you there? What process took place to have Amanda show up at their door?
Yeah, so they reach out to a CBHI program.
Meaning the family reaches out.
Correct.
Because they see there was somebody, they reach out because...
Some sort of behavioral concern or mental health concern
Okay.
for the child.
Okay, yeah.
And so either they reach out and self-refer,
Mm.
or a primary care provider can refer them,
Okay.
or some other provider that they're connected to may have referred them to the program.
Okay.
So then we're connected to them as the clinician, and we are taking on the case and reaching out to them, getting the case started. So we would have their information and go from there
And you would
show up at their door.
Show up at the door, not
Yep.
knowing exactly what to expect. I'm sure you had some information, but you had
Right.
to say, okay, how do we assess the situation, and what do we do?
Yeah.
And you would meet with children as young as 3.
As young as 3.
Wow.
Yeah.
Up to 21.
Up to about 21, yeah.
Wow. You learned quite a bit.
Absolutely. It was a lot. It was a lot of learning very quickly.
Yeah, stuff you didn't learn in college.
Yeah.
Right. I mean, they're real situations. Okay, now what? Well, that's interesting. And so, but you were doing that. What did you enjoy about that job?
That job, I really appreciated being able to see the whole picture of someone's life as far as like what's impacting them here, whether it be something in the home, whether it be something at school, whether it's something with their physical health, like, and you're able to work with them in all of those domains and support them and their family. So that collaborative approach is really helpful. And to be able to see all of that, you're able to put more of the puzzle pieces together, per se.
Okay. Did you find any commonalities between, let's say, when you started visiting families and people, that there was a common contributing factor to the issues that you were seeing? Or was it just various things?
I would say it's probably various things.
I guess I'll clarify a little bit
Sure.
because it's sort of a broad question. But thinking about when we met with, close to 80 people now, and I've heard several times. Yeah. I think one of the biggest factors that people have, that children, in terms of their propensity to drink or take drugs, is not having a mentor person. Male, female, having two parents is always very helpful, but if you grow up in a single parent household, to have a mentor that you're connected with, a coach, a teacher, somebody who's connected to you, is such a makes such a difference for that. And I thought, okay, that in itself is a big difference. Okay. It could be that the parents themselves have some mental health history issues or substance abuse. Did you see a pattern, I guess, with whether it was substance abuse or prior mental health issues or single-parent homes that you found were common things, or was it just kind of all over?
It was kind of all over the place. Yeah. It was really like every walk of life, every population. It was very diverse as far as like who we were working with. But so you mentioned mentorship, and I think with the CBHI program, they really do try to mitigate that, because you're not only having a clinician come into the home and work with the family, but you have a therapeutic mentor as well. So it is someone who is working with the child in kind of more of that mentorship role. So that's built into the program to mitigate that.
Doesn't it help? I mean, it really is the difference, and it seems like an obvious, but I never thought about that. If you once you identify something like that, and this is where they found that, I think it was Amanda Lennox that was on. Amanda's great. She does the Care Coalition in West Springfield, and she's just great with the kids, and so we talked about that a little bit. It all just came back to me. But so working with the children, though, you did that. You didn't stay with that because you moved on.
Correct.
Again, you've been just hitting it, and so you moved on to your current job? Yes. So tell us about your current job and what you do.
So currently I'm in community mental health, and it's more of that typical what you think of when you think of therapy. You're coming into an outpatient clinic, sitting down with a clinician in an office, and talking and processing and exploring your stressors and what you're struggling with, and kind of that stereotypical therapy.
And that's the outpatient services at Westfield Clinic of River Valley Counseling Center.
Correct.
Now, if somebody wants to know more about it, what is the website?
The website is rvccinc.org.
rvccinc.org.
Correct. So
okay.
rvccinc.org.
Good. The ink is sometimes spelled with a K. Right. Good point. And so you've been there for
about 5 years now.
About 5 years, yeah. And what's a typical day like?
So I am also in more of an administrative role. So I do carry a caseload and see clients, but I also provide supervision to clinicians and oversee the Westfield Clinic and the functions of that. So it's a pretty diverse day in my role.
Yeah. So you're overseeing clinicians, and you have a small caseload yourself?
Correct.
Yeah. How do you feel now after 5 years in the job, but with your prior experience, and I guess with new people that you supervise, what do you tell them? Look, because with the experience that you've had now, your eyes were opened through your job in Greenfield and what you're exposed to, sometimes being physically confronted, and then with the children, and you see, so you've seen a lot in a short time.
Right.
How do you find the clinicians, the people that work for you, are adapting to their jobs, and how do you have to? It's tough work.
It is.
And is there burnout? And so, how do you address that with the clinicians that work with you?
Sure. So this is probably a loaded question for me.
Yeah, because at one point maybe you were burned out too, right?
Yes.
So you can relate to that.
Yeah. So I feel like this is a very layered question for me, as far as I think first and foremost, primarily, I love to help clinicians learn and grow in their career.
Well, you know why? Because you've been thinking about it since 3rd grade. So you've had a lot of time. But anyway, I didn't mean to interrupt you.
No, that's okay. So as far as like helping them learn and grow and develop in their career, I think one of my main focuses, or a couple of my primary veins of focus, are safety for not only their clients but themselves. Being clinically sound in their work, and also taking care of themselves so that they are not burning out and they're able to provide quality care to their clients. And they're also able to go home at the end of the day and still take care of themselves and their family, and have room for that.
So easily said. It's just a little harder to do, isn't it?
It is.
It is. It is. But you have to be constantly aware of that. As a manager, as administrator of the program, you have to make sure that everybody's good.
Right.
Has anybody said, I can't take this anymore?
I have had one clinician at the very beginning of her career. She had just graduated, and this breaks my heart. I felt so bad for her. She had just graduated, and this was around the time of the pandemic, around COVID. She had a heavy caseload as far as substance use, and she did have a couple of clients pass away. And I don't think she made it 6 months into her career, and she said, I can't do this, I have to walk away.
It's very hard.
Yeah.
And we've met with and spoken with so many care providers, treatment center directors, counselors. It takes its toll.
It does.
It does. And when you're working with families, with people, you get to know them, especially with substance use that gets out of control, addiction, it becomes, and then you lose people. You can't, at the end of the day, say, yeah, okay, I'm going to turn it off. It's very, very difficult. And I think that doesn't get talked about much, because you talk about the care providers themselves needing care.
Yeah.
Right?
Yeah, absolutely.
That's very important. And with all of that, though, you've got to find some rewarding aspect to your job. What do you find keeps you going and most rewarding about what you're doing?
So I feel like I have both sides here, as far as being able to support not only clients but clinicians. So that's what's rewarding for me, is that I get to give back to both. I get to give back to clients and clinicians, and support both sides of that field.
Mm-hmm. Okay. Do you ever think about giving up?
No. I love it. Absolutely love it.
See, yeah, you were meant to do this type of job, weren't you? But that your story, your career doesn't end right now. I mean, you got a long way to go, but meaning you're involved with other things too.
Yes.
As we said earlier, you are just recently opened up recovery center.
Yes,
in East Long Meadow.
Yes, so I just recently partnered with Balanced Recovery Center in East Long Meadow as of October, but they've been open since July.
Okay.
And started taking clients on in August of this year.
what brought you to that to the recovery center?
So I was approached by a mentor of mine who was aware of my background in the field and a lot of the connections that I have, that she felt would be really valuable and supportive to their approach and their vision as far as working with first responders and veterans, but they are serving the community. So not just first responders and veterans, but the community. So it's also a really holistic approach that they're providing to clients.
Meaning, to talk about what that means.
To circle back a little bit, art therapy is included.
Okay.
Reiki, massage therapy, acupuncture, yoga, there's sound healing, individual therapy, group therapy, and family therapy.
It's completely outpatient?
It's a partial hospitalization intensive outpatient program.
Okay. And it's in East Longmeadow?
It's in East Longmeadow on Denslow Road.
Balanced Recovery. Do you have a website?
Yep, it's balancedrecoverycenter.com.
Okay, that's easy. Balancedrecoverycenter.com. And how's it going so far? Because it's only been since July.
It's going great.
Yeah?
Yeah. We've had a great run so far.
Okay.
And
how do you split
keep
your time? You find the time for all this?
Yes.
Yeah.
Very busy, but
Wow.
I make time for it.
Wow. In the recovery, I mean, the type of people that come in recovery from, whether it's alcohol, substance use, what type of people would go to balanced recovery?
So 18 and above is are the population that we're serving.
Okay.
So adult population. But again, very, very diverse as far as population, demographic.
Yeah. Through your experience, though, did you ever think that you'd be working with in a recovery center or be involved with a recovery center? This wasn't part of your original plan, was it?
Yeah, not particularly. Substance use has been an area of interest for me, but not so much like the forefront. I would say PTSD has been more of one of the number one diagnoses that I've always wanted to work with. But with the recovery center, it's a dual diagnosis, co-occurring disorder program. So a lot of clients do have PTSD and substance use.
And PTSD can come in so many forms.
Right.
It can go on, and as you've recognized over this time, but yeah, there's a lot of connections. Well, you're certainly making your own footprint in this industry, if they call it an industry, but it's in mental health field, in recovery, and it looks like with your energy and your passion for doing this job, because I think you were born for it. There's nothing else you were.
Thank you.
And that's wonderful. And I'm glad you mentioned the PTSD, because I know that we talked about that when we were talking, because even with children who you've worked with before, you recognize that this has such an impact.
Absolutely.
Yeah. So, yeah, well, you've got a lot going on. So you're at Balanced Recovery in East Longmeadow.
Correct.
And the outpatient services at Westfield Clinic of River Valley, which is rvccinc.org. And we're talking with Amanda Hichborn, so far with, close to 10 years in the field, right?
Almost, yeah, creeping up.
You got about 40 left.
Yeah.
So good luck with that.
Thanks.
We'll have you back on in a while and see how everything's going. But you're doing great work.
Thank you.
And really, I think what you're doing and your commitment to this is great. And I think, again, you've recognized something. I'm still trying to figure out what I want to do for my career. You knew it in third grade. I'm jealous of that. So, well, I appreciate you coming here. And so thanks, everybody, for listening. And remember to visit our website at healingvoicesproject.org. Thanks, Amanda.
Thank you.
Appreciate your time. And thanks, Les, for everything. And we'll see everybody real soon. Thanks.